Today, we're going to speak about upper limb fractures in orthopedics based on the notes which I've created after watching BTR and Plada videos. So these are the things which I discuss in this video. First, clavicle fracture. Clavicle is the most common bone to be fractured. The most common part to be fractured is medial 2 by 3rd and lateral 1 by 3rd. The type of bandage used is figure of 8 bandage as you can see in the image. The most common complication of clavicle fracture is malunion. Next is humerus fracture, which can be further divided into proximal humerus fracture, spiral groove fracture, lateral condyle of humerus fracture, and supracondyle of humerus fracture. In proximal humerus fracture, we use Neet classification and the nerve to be injured is axillary nerve. Spiral groove fracture is also known as Holstein-Lewis fracture. The nerve to be injured is radial nerve. Lateral condyle of humerus, we use Milch classification, and ulnar nerve palsy is a very late complication. The deformity seen is cubitus valgus. In supracondyle fracture of humerus, we use Gartland classification. The order of nerve damage is axillary, medial, radial, or ulnar. The deformity seen is cubitus varus. The terrible triad of elbow includes the fracture of radial head, fracture of coronoid, and elbow dislocation. Essex Lopresti fracture involves radial head fracture, interosseous membrane rupture, and radio-ulnar joint dislocation. Mason-Hughes fracture involves neck of fibula fracture, rupture of interosseous membrane, and malleolar fracture. In this image, you can see Mason-Hughes fracture where there is fracture of fibula head, interosseous membrane rupture, and malleolar fracture. In Essex Lopresti, you can see fracture of radial head, rupture of interosseous membrane, and dislocation of radio-ulnar joint. The distal radius fracture can be divided into extra-articular and intra-articular fracture. Extra-articular fracture, there could be anterior displacement or posterior displacement. If there is anterior displacement, it is called Smith's fracture or reverse Colles fracture. In Smith's fracture, we have fall on outstretched hand with flexion. In posterior displacement, we call it as Colles fracture, which is fall on outstretched hand with extension. A risk factor is osteoporosis. The deformity seen in Smith's fracture or reverse Colles fracture is garden spade deformity, and the deformity seen in Colles fracture is dinner fork deformity. In intra-articular fractures, we could have radiocarpal dislocation, and the fracture is called Barton's fracture. If there is fracture of styloid process of the radius, it's called Schoffer's fracture or Huntington's fracture. This fracture occurs due to avulsion of brachioradialis tendon. We have to learn about Galease's fracture and Montague's fracture, and there is a fracture dislocation complex. In Galease's fracture, we have inferior radius fracture and radio-ulnar joint dislocation. In Montague's fracture, we have superior ulnar fracture and radial head dislocation. We can remember it using a mnemonic grimace, where G stands for Galease, RI for inferior radius, M for Montague, and US for superior ulna. We can also remember it using another mnemonic Murga, M for ulna, Montague for ulna, and Galease for radius. Nightstick fracture is the fracture of ulnar shaft. It is seen in elderly abuse. Greenstick fracture is seen in children as children has fragile bones. It is a unicortical fracture. Only one side of the cortex is affected. Metaphyseal corner fracture is seen in child abuse. Torus fracture is a bulging or buckling of cortex. There is no breach of cortex here. There is only a bulging. The normal alignment for the wrist is capitate, lunate, and radius. All these three align in the same line. If the lunate slips anteriorly or posteriorly, we can say it is lunate dislocation. And if The lunate and radius is in the same line and the capitate or the phalanges, any of the above, slips out. It is called perilunate dislocation. Terry Thomas sign is seen in scapholunate dislocation. There is an increased space between the scaphoid and lunate. Terry Thomas was a reporter in the United States and he had gap in between his teeth, and the radiograph looks similar to that. The first metacarpal fracture, it could break into two fragments or three fragments. If it breaks into two fragments, it's called Bennett's fracture, and if it breaks into three fracture, it's called Rolando's fracture. Fifth metacarpal fracture is also known as Boxer's fracture. We should be able to differentiate between thumb out cast and thumb enclosed cast. Thumb out cast is called handshake cast and it is used in Colles fracture. Thumb enclosed cast is called glass holding cast and it is used in scaphoid fracture. A quick recap: Montague's fracture is superior ulnar fracture and radial head dislocation. Galease's fracture is inferior radial fracture with radio-ulnar joint dislocation. Essex-Lopresti fracture of radial head and interosseous membrane rupture and radio-ulnar joint dislocation. Please try to answer the questions after watching the video.